On the Medical Watch, vaccines are working in children. Pfizer just released data from its study of children ages 12 to 15. Not one of the children who got the vaccine was diagnosed with COVID. Good news, but is it enough to ease parents' concerns? Joining us now with some perspective on COVID vaccines for children, Dr. Julie Holland, who is the Vice President of Pediatric Primary Care for Chicagoland Children's Health Alliance. Thank you so much. I think we need reminders all the time here. When it comes to immunity, Pfizer said that this vaccine worked better in children even than in young adults. Good news, correct?
Great news. This is all very exciting to hear about. You know, we have been really hopeful that we will have a vaccine for kids coming up in the next few months, and the Pfizer vaccine really confirms that at least for 12 to 15-year-olds, the vaccine seems to work quite well. Now, you know, it was a small group of patients. It was about 2,200 kids, and half of them got placebo and half got vaccine. But in the vaccine group, there were no cases of COVID, so that is great news.
Pfizer did admit that many of the children got side effects from this, headaches, fever, muscle aches, things like that. But that's potentially good news when it comes to immunity.
Right, and I think the other bit of good news is that those side effects weren't really substantially different or worse in kids than they were in young adults. And so it's the same kinds of things that everybody's been talking about with the COVID vaccine. The arm soreness from the vaccine, and then a fair number of people within 1 to 3 days get fever or chills or body aches, and those are all really normal side effects from this vaccine.
I know there are a lot of parents who are especially concerned about this, and what they'll say is that most children with COVID don't get really sick. So why do kids need the vaccine? Can you answer those concerns?
Sure. Well, there's a number of reasons. I think, first of all, you know, as a pediatrician, we spend a lot of time talking to parents about vaccines and illnesses that vaccines prevent. So the next big part of this job is on us pediatricians to talk to parents that this is safe and effective. Although it is true that kids aren't generally as sick as adults, there are a lot of kids that got sick with COVID in the United States in the last year. There were about 13,000 kids that were hospitalized and 268 deaths from COVID. That's a lot. It's a lot more than we see every year with flu deaths in kids. It's a lot of kids who hopefully that this will not happen going forward if we can really protect everybody. The other big reason we want kids vaccinated is to work on this concept of herd immunity. You know, we're all safer if we have herd immunity because there's a lot less virus circulating and it makes everybody safer. And since kids are about a quarter of the US population, we need that group of people vaccinated as well to really beat COVID.
And Doctor, can you also address this idea of herd immunity and how that may thwart some of the variants?
Right. So if we have a lot of people that are immune to COVID, there's a lot less people that can get the virus. And so with the new variants circulating, and if you're immune to COVID, your chance of getting the variant is very small. And that really does not allow the variants to get a foothold and really start circulating in large amounts. And we know some of these variants are much more contagious than the COVID that emerged a year ago. So we really don't want to have a more infectious type of virus circulating.
I want to get back to something you said a little earlier, and that is you talk with parents a lot about vaccines, and I think that's something that I was really surprised about. We give our kids so many vaccines, and the same parents who are clamoring to get themselves vaccinated are then saying, ooh, I'm not sure that I want this for my child. What are the biggest reasons that you're hearing for the concern?
Well, I will say personally, I'm hearing a huge amount of enthusiasm for this vaccine, and I think that's great. But I think any parent will want to understand all the things that we talked about and the safety profile. Again, you know, people tend to get this vaccine and have their hesitancy addressed when they understand the safety profile, the effectiveness, and parents are going to be no different in this situation as well. We've seen a lot of vaccine hesitant groups really change their minds as they've gotten more comfortable with the vaccine, more aware of it, and more aware of really the amazing benefits that this vaccine provides.
And I think when we listen to doctors like you and not social media, thank you so much for your advice and expertise.
You're very welcome. I'm glad to be here.
Dr. Julie Holland.